Thank you for joining DFWChild's Baby Day. We are here with Dr. Philip Ewing. He is the Pediatric Emergency Medical Director with Medical City Children's Hospital in Dallas. Dr. Ewing, thank you for being here today, and we appreciate all of Medical City Healthcare's support for Baby Day.
Thanks, and good morning. Thanks for having me.
Yeah, well, we're going to talk about something important today. No parent wants to have a medical emergency with their child, but it can happen. And it's wonderful that we have great pediatric specialists here in DFW like you who can care for baby and guide parents through that difficult time. And today we are talking about RSV, which is a highly contagious respiratory virus in children. And of course, there's so much attention on COVID right now, but parents can't lose sight of RSV, which I understand is much more common.
It is more common, and this is the time of year where we really think about it more. Once school gets back into session and fall starts, that's the time that we start to see RSV, and we're most worried about the smallest children that we have, the kids who are less than 6 months of age, and then especially babies who are premature or have heart disease.
A lot of parents may have heard of RSV, but they don't know exactly what it is. So tell us a little bit about RSV and the symptoms.
So RSV is tricky because it's really a respiratory virus and it can look like a lot of other things. The younger you are, your symptoms are probably more severe, whereas if you're an adult, you may just have a runny nose or a slight cough and not think much of it. So if you're younger, these symptoms can cause more problems and lead to problems with breathing and the need for hospitalization in some kids.
So it's very stressful, of course, for parents anytime their baby is sick. How do you know as a mom or a dad when it's time to take baby to the ER versus making a regular appointment with your pediatrician or continuing to care for baby at home?
A few ways to look at that. First off, RSV can cause fever, and if you have a child who is 2 months or younger, that's the child who should be seen promptly by their physician or even in an ER after talking to their doctor. The other things that are worrisome is if you're having breathing difficulties, especially with color change to the face, lips, and hands. And then some patients are having such breathing difficulties that it prevents them from eating and drinking properly. And you see that they have signs of dehydration. One of those signs can be that they're not making as many wet diapers as they usually would.
How do you know for sure that a baby has RSV? When you talk about fever, people start to think COVID. What's the diagnosis process?
So the diagnosis of RSV is not as important as seeing what the symptoms are. However, coronavirus and flu are two that we'll have to think about if a child has the symptoms of RSV, which causes the disease bronchiolitis. Bronchiolitis is when you have a lot of inflammation in the airways, you have a lot of secretions coming out. All three of those conditions will cause those symptoms. So this year, it's going to be especially important to diagnose RSV so that we understand that it may not be those other two.
How do you treat RSV, whether it's in the hospital setting? I know you mentioned an IV at one point. So treatment in a hospital and treatment at home.
So the basics of RSV and bronchiolitis treatment is to basically keep the nose as clean as possible because there's really not a great medicine that we have to use to treat RSV. Some patients will do well with just keeping the nose clean, and that's with using simple saline drops to clean the nose, and that's best done before the patient eats and before they sleep. Second thing that can be helpful is to have the patient sleep with their head above their belly at an angle so that any of the secretions are draining to their stomach rather than getting collected in the throat where it can cause more breathing problems. But if these simple things aren't working at home, especially if there's fever or concerns about dehydration, it is a good idea to talk to your doctor because sometimes we need to do more aggressive treatment if the baby's not doing well with the simple treatments.
And would you say that, the bottom line is if you're concerned about your baby's well-being, err on the side of caution, seek professional help, that COVID is not a reason to not go to the ER if your baby has some kind of issue that you're really concerned about?
I think that's a great way to say it. I think this winter will be different for us because we have this new virus that's circulating. We'll have the flu eventually as well. If your baby is sick and you think they need attention, they need attention. if you are concerned about coronavirus, we can help with that as well. But I think the biggest message there would be not to stay at home if you have concerns about your baby, because you might get coronavirus by coming to a hospital. All hospitals now are using methods to prevent the spread of RSV and coronavirus and flu. And so you'll be protected from that, but it is important to come wearing masks, to observe social distancing when you can, to be sure that until you are in a place where you're isolated from other patients, you have a lower risk of either catching it from another patient or then spreading it to them as well.
Thank you so much, Dr. Philip Ewing, for your expertise, and we thank all of Medical City Healthcare for your support of DFW Child's Baby Day.
Thanks again for inviting me. It's been my pleasure.